FND is, in the literature, what they call the, quote, marriage of neurosciences and psychology, because it is your neurology that drives your psychology. And when you're talking about a neurological based issue, mixed in the fact that it has emotional and psychological based problems, then what is it? Well, it's both. And you have to use both tools on both sides of this spectrum, if you will, to help it. Well, all right, everyone. Welcome back to the Dr. Alex Show. And it's definitely been a bit of a gap, and I apologize about that. It has been busy, and I'll go into that here in a second, but I'm excited to be back in studio. Producer Nick and I were texting back and forth, and we're like, yes, this is overdue. We need to get back together. Schedules weren't lining up, and life's busy. So speaking of life, when it comes to giving presentations, I recently got to give a presentation for the International Association of Functional Neurosciences and Rehabilitation, and I think Dr. Lauren and I are going to give a presentation for one of the chiropractic schools here coming up soon. Whenever we present, or whenever I present, I like to just let people know about myself. I think it's good to know who it is you're learning from. And what's been going on with us is practice has been very busy, and it has been a blessing. With that, a lot of our staff for years were actually cycling interns. So we had a couple of the local colleges sign us up on a program where we would have an intern come in for, it's about 3 months to 6 months. And then honestly, they were always so great, we'd hire them. So they would work for us. They would get trained up in that time frame. They'd get experience, and then we'd hire them. And then they work for us for a little bit. And then they'd go off to grad school or move on with life. And it really just cycled like that. It was awesome. And I liked it the most because it was constant learning for myself. I know Dr. Lauren liked it too, because when you have to explain what it is you do to someone on the regular basis, then you really start to own what it is you do. And that situation just kind of dried up. Interns were just not showing up, just based on student needs. Nothing happened. It was just how things are ebbing and flowing. So then we had to hire some people, and things didn't work out. They just found different opportunities, and then it was just Dr. Lauren and I. And honestly, that just took up a lot of time, taking care of the office. And then, of course, racing. So for those of you who don't know, my son does go-kart racing, and we're knee-deep in it, and we're out of control. There's just no other way of putting it, in the best way possible. So that's what we've been up to. And with that, now that we're finally back in studio, I want to talk about something that's way long overdue, and I'm kind of embarrassed that we haven't talked about it. And that's a condition called Functional Neurological Disorder. And some of you are going to be like, what is that? Well, it actually starts with some of the AKAs, the also known ases. And with some of these also known ases, it still might get sprinkled in and used for just current terminology purposes. But this is a disorder that was once known as functional neurological symptom disorder, functional movement disorder, conversion disorder, neuropsychiatric disorder, psychogenic seizures / movement disorder, dissociative seizures / movement disorder, non-epileptic seizure disorder, dissociative neurological symptoms disorder. With all of those disorders and AKAs, it doesn't mean that those do not exist anymore. That's not the case. It's just, it's been a bit of a reclassification of things, and there's reasons behind that don't necessarily matter. But from here on out, I'm going to refer to it as functional neurological disorder, because it does include an array of symptoms, a lot like autism, where autism is a spectrum. And one person with autism can have a plethora of traits, and then the other with autism doesn't quite have all of those traits, but they have enough to be diagnosed with it. So it's a bit of a spectrum, if you will. in that regard, and it truly can run amok on people's lives, and I think it's up in prevalence currently. So, what is functional neurological disorder? Well, if you're listening to this, it means you already know what it is, and if you don't know what it is, then you're intrigued because you're like, I have never heard of that. And it's a disorder that encompasses all symptoms, for the most part, that are all what we call functional. So it really lives in this functional neurological world, if you will. I mean, it's in our name, for crying out loud. And with the functionality of it, it means that there's nothing found on MRI, CT, MRA, nothing on traditional imaging where there's anything wrong with the brain. So there isn't a stroke situation that occurred. There isn't some other form of blood loss pathology occurring. There isn't a tumor. There isn't some sort of degenerative process. Everything appears to look just fine. And that's where the mystery comes in. And unfortunately, it's where the controversy kicks in too, because in traditional medicine, if you can't see it, it can't be diagnosed. A medical doctor wants to be able to see what it is they're about to work on or treat. And with FND, as it's called, you just can't see it. You can see the symptoms it produces, but you can't see it in blood. You can't see it in imaging. You can't see it in traditional tests. So it can be quite aggravating at times for doctors to treat, wrap their head around, find someone to refer to. And sometimes these people get kind of thrown around the medical merry-go-round. In England, there's a few there's a few great practitioners that I've heard of, and there's a couple of the associations for FND that are based out of England. So it looks like England has their act together a little bit. Maybe a couple of their other surrounding countries have their act together with it because they're doing a better job recognizing it. But after you scrounge around on the Facebook pages and the online communities of people diagnosed with FND in that area, they'll say, yeah, we got it figured out, and that's a blessing, but man, we don't have anything for treatment. So it's still not getting well taken care of, and it's definitely gone up. But let me backtrack a little bit. So depending on where we're talking, anywhere from 4 to 12 out of 100,000 people are affected by it. Females are going to be affected more than males, and I'll get to that. 2 to 3 times more likely, in fact, quite a bit more. And functional movement disorders, so another AK, if you will, but issues with movement and FND usually start to appear in people's 30s. And then some other stat that was gathered is functional seizures start with people in their 20s. So why is it happening? It's one of those, we don't really know for sure. It's definitely multifactorial, which adds to the mystery and exactly what's going on. There's going to be other disorders usually associated with this that adds fuel to the fire. But it's a bit of a step-by-step process after it gets broken down. So one of the first steps, and if you just hang with me, it'll help make sense for those of you that are diagnosed, or maybe someone that you know that you're listening to the show for, or you're just wanting to learn. If you hang with me, and we can get through this bit of a geek speak dork talk of it, then the rest of this is going to just come with the most clarity. The first step is most of the time you're going to have what's called predisposing factors. And if you're watching the video, I apologize because I have a list of things in front of me. I just don't want to miss anything. And it's been a while since I've given this presentation. So you're going to have predisposing factors. So you're going to have other neurological based disorders or symptoms already going on. You could already have something like IBS going on, irritable bowel syndrome. You could already be prone to anxiety or depression. You could have stressful events in your life that are occurring. And I'm not talking like the necessarily the daily grind, although that can be it. I'm talking about ongoing, pretty hellacious stress and even trauma. You could have a past of having childhood trauma and childhood adverse childhood experiences, or ACEs as they're called. And also, what is interesting is sometimes individuals with FND, after they're diagnosed, one of their predisposing factors is it's kind of odd saying it is the fact that this person doesn't have any vulnerability. And it's like, what does that mean? It means that this is someone that maybe hasn't been through any sort of rigorous stress in life, and they almost all of a sudden got hammered, and then their neurological health changed for the worse. So then we have someone who has one of these issues occur. Then we move into this stage of what's called, like a stage, if you will, called triggering events. So take the list of predisposing factors, if you will, and add on other things like, further again, depression, anxiety, other gastrointestinal issues. Concussions is a big one, and we've done our show on concussions. You could have current adverse childhood experiences if you are a child, further out of control stress. And then the other thing that has to get noted is the daily grind. So predisposing factors and triggering events, they can all be kind of the same, because, well, it's just that when you have one thing going on, it finally might settle down, but the health effects of that stressful event had already beaten down your health. It's already lowered your resilience. So then we move into the next, call it triggering event or predisposing event, and it's a migraine, or it's a head injury, or it's a infection. That's another one. It's a nasty drug side effect to a drug that medication that you are trying to better your health for some reason, or maybe you're trying a recreational drug and it didn't go well. You could have a dissociative event. That's a big one. That's where this conversion disorder, or this old term, comes from. You could have derealization or depersonalization or amnesia occur. Either way, we have something nasty going on. Then we have another nasty event going on. And then with I guess the biggest triggering event that I think has led to a rise in FND is, honestly, we got to go back to COVID. Hate to say it, because COVID has brought out a lot of distress in our teenagers. And that's the general population that we're seeing with FND. For the first time in a while, we have an adult with it in our office, but it's right now currently primarily female teenagers. And COVID as a triggering event was big in this regard, because even if we think we're introverts, the thing is we are social beings. And COVID absolutely disrupted most of our lives in a lot of regards and caused a lot of distress, a lot of social distress, physical distress, emotional, of course. And it's just such, still to this day, a quote triggering word and event for people because of that. So why does it affect females more? I think because I have to further explain what FND is, but with FND, a stressful situation usually entails social and or emotional stress, and women are typically more social. That is how y'all are wired. You are meant to be social. You are meant to be in those salons cackling away. You are meant to be on the phones late at night with your girls talking, all of that stuff. And it's not that some of that was disrupted, but being socially together was really disrupted. And that was, I think, such a huge triggering event. And when COVID hit, we for sure had only seen a couple FND people, and it was very interesting to take care of these people and get some help. But then it's like they kind of came in droves, and they're still coming in. But it with the COVID piece, it's like, it's not to like keep rehashing that, but it's big, and it's still affecting people. And on that note, it was something to keep an eye out for our children that were born in COVID. Some of the research is coming out that these poor kiddos, now that they're 4 or 5 years old, or 3, 4, 5, they're already having quite a bit more neurological, developmental based issues within their populace set than others pre-COVID, because of just the distress of what COVID had done to their parents. So then the next thing that has to happen with people with COVID, if you will, is there needs to be, it doesn't need to be, we don't want it to be, but there's going to be some comorbidities. And the comorbidities is just like another fuel to the fire, another gas can to just pour over it. It's going to be more of the same: stress, infections, being overweight, anxiety, depression, PTSD, pervasive pain based issues, pervasive dizziness issues, other neurological disorders. And then with the last little bit is going to be what we call perpetuating factors. So it's like all of these really start blending together, but you have a predisposing factor, you have triggering events, then you have these comorbidities that were already there on top of all of it. And these what's called perpetuating factors, this is where some of the almost annoyances and controversies of COVID come in. And a lot of times when people go and get help with this, they're not believed. They're kind of sloughed off, and the doctors don't know what to do. They are at a loss, so then the patient loses hope. There's just no medical understanding. At times, these people are kind of shunned away from the medical community. Doesn't matter where you are in the country. There could even be unnecessary surgeries because they think that there's something going on physically, but there isn't, because there's nothing wrong with the brain in terms of a physical standpoint. All of that is just factor upon factor upon factor that leads to this situation. So you're like, okay, so what's the situation, doc? Well, the situation a lot of times is these people will lose motor function. They lose the ability to sense their body. What FND is, after you got this, 30,000 foot bird's eye view of basically a highly stressed out person, is it's a loss of motor function of sorts. There might be seizures. There might be constant headaches, dizziness, migraines, and there's a loss of sense of self. They really don't know how they feel, or sometimes even who they are. So in the buried in the websites and even in the literature, it doesn't really get technical, which is funny, about what is FND. And it basically says it's a mishmash, a mix-up of motor output, your brain telling your body what to do, like my brain right now telling my arm to move up and down, and what is a input, a sensory signal. Like currently my brain is understanding that I'm sitting in a chair, I got some gravity forces acting on me, I'm sitting upright, my eyes are moving they're being moved by my brain, but also driven by my vestibular system, my inner ear system that tells my brain where my head is in space. I have a sensation of being in a chair as it's brought to my attention, because it's not like I'm thinking about having my butt sitting in a chair until I think, oh, my butt's touching the chair. But what's happening with a proper operating brain is the brain is taking all of this input in, whether you are consciously thinking about it or not. Your butt's in the chair, you're sitting upright, the room's at 70 degrees, there's a slight breeze from the HVAC, and life is good. And then it also is understanding that you're moving your arms because you got to talk with your arms. You're moving your arm up and down to demonstrate what a motor output is. But in the brain of a functional neurological disorder-based patient is that those signals can quite literally be reversed. The wiring is all there, but how the brain makes sense of it, quote, is not. So motor signals could kind of be sensory signals and vice versa. Or where it starts to get funky is even your emotional output. So when you are processing the world around you, all of that gets put through your limbic system, and then you're going to have an output. You're going to have a response. You're going to be happy, glad, surprised, angered, disgust, whatever the situation is, you're going to have a response, cool, calm, collected, whatever it is. Well, your brain might get those emotional outputs mixed up. So what could be anger could be a motor function. It could be tremors. It could be seizures. It could be a lack of walking, because that's a big one. These patients have an inability to walk appropriately. Our biggest case in office is still to this day coming in office for support. And she hasn't lost her ability to walk since we got it back, but this individual had lost her ability to walk. Just one day, woke up, wasn't walking, and went to the ERs, went to the specialists, and got worked up, went to the children's hospital, all of that good stuff. And this girl was told that what you have to do is give it 5 years and you'll walk again. And I don't know where the specialist got that information. I highly respect that specialist. And to this day, I don't know how to make sense of that, like where that number came from. But she was told, for example, it's going to be 5 years and you have to go and do cognitive behavioral therapy. You have to talk about it. Because again, emotional output is getting mixed up with motor output. Sensory signals are mixed up. So you have to start to make sense of it. You have to start to wrap, quote, your head around it to come up with tools to help yourself. And for as crazy as this sounds, like this is actually happening. And this girl somehow found us. I can't quite remember off the top of my head how her mom found us, but thank goodness. She got in and we started working with her, and after giving her a good functional neurological workup, I found that what was intact with her motor function was enough to make things work, because the brain kind of fell apart. She was very apathetic, kind of had a sense of humor, so you kind of saw some personality, but she didn't feel things very well. She didn't know what was hot or cold. She didn't know if I was touching her left leg or right leg. She didn't know if she was wearing clothes. She didn't really know colors. She didn't really know auditory input from anything else. But her motor function, what was there, the foundations of motor function was very low. It was like basically a toddler's level. So the foundation of motor function was there from a developmental standpoint. And I was like, aha, she can't walk. Yeah, she's like double digits, and we're, I think it was 11 years old at this point. We have an 11-year-old that was walking, that isn't walking, but developmentally, her motor function is at toddler, infant. We can kind of roll over, we can crawl a little bit. We certainly can't walk. So I treated her motor system like she was a infant/toddler. And we got to work using all of her fun gadgets and gizmos, and 8 weeks later, she's walking. and she's been walking since. However, with the ongoing distress of life, the fact that she's a go-getter and she can't just rest, and a multitude of other factors, this individual has undergone an array of seasons where, yeah, we're walking, but we don't feel our body as well. Now we're feeling our body, but now we're having seizure-like issues. Now that's kind of going away, but now we're having some dysmetria with how we're trying to use our hands or use our feet. Now that's kind of gone away, and now we're having a hard time sorting out all the emotions of all of this nonsense that's going on. And now we're just kind of sick and fed up with things. So then that kind of makes everything fall back apart. So that is a hard one, and it is ongoing. And right now this individual's in a good season, but we are still not out of the woods. Now with some of these other individuals, it could be they weren't walking, they came in the wheelchair, and a week later they're walking. And as obnoxious as that sounds, as asinine and almost arrogant as it sounds, they're doing great. Couple visits, some of these people are great. The current adult we have, we're finding that our hyperbaric oxygen chamber is the main thing that she needs, and she's coming along steadily. But with her, for example, there is a very good emotional piece to this, because she had some triggering events of trauma as a kid that had hung on. Then she had some other predisposing health factors. And then with the big triggering event, that was further emotional trauma. So we lost a lot of physical strength. Everything body-wise she could feel. She had great cognitive abilities, but just couldn't really walk around very well. So on top of doing some hyperbaric oxygen therapy and a couple functional neurological visits to kind of get a boost out of her, what we found, what worked best, was she found a specialist out of Arkansas. And when she comes along her day or goes along her day and she all of a sudden feels weak, she has to simply be like, yeah, that's not going to happen anymore. And she has to tell herself she's strong. She has to say, I am strong. I can do this. Or if she's about to feel overly fatigued because all she did was walk across the house, she has to say, I'm very energetic and I'm ready to take on my day. Because the brain has things mixed up. It may not be that she's fatigued or weak, because she shouldn't be. It's that her brain is getting things mixed up, again, with what is a motor output, what is an emotional output, and then what is emotional processing and sensory input. So it can be very complex, but these are all, again, going way back to the beginning of this, functional-based symptoms with nothing going on pathologically in the brain. Things are really unsorted and just mixed up. And the kicker with all of it is this isn't anything that is just coming to a head now here in 2025 now, or 2024, or COVID. These are disorders that have been named different names throughout the time of recording modern medicine, if you will, at the very least, if not further. It's just, I think that with our ongoing distresses of today's modern society, it's getting worse. Because, for instance, if you look at, to use autism as another example, if you look at developing countries, third world countries, they have things to worry about, like clean water and getting food, for instance. But if you go over there and you ask them, hey, how many people around here have autism? They're going to look at you like you're an alien with two heads and be like, what is that? It doesn't exist, because autism is so highly contributed to, it's not the only thing, but a highly, highly contributed to the stressful factors of our society and our lives that we're living. So I think that's why this is, generally speaking, going up. And to add confusion to it all, I wasn't sure when or where to say this piece, is FND is, in the literature, what they call the, quote, marriage of neurosciences and psychology. because it is your neurology that drives your psychology. And when you're talking about a neurological based issue mixed in the fact that it has emotional and psychological based problems, then what is it? Well, it's both. And you have to use both tools on both sides of this spectrum, if you will, to help it. Because all of the fun neurological tricks in the world is not going to help necessarily rebuild a limbic system or a frontal lobe to process and rationalize through what is going on in that person's life, like why they all of a sudden lost the ability to walk or move appropriately throughout space. And then likewise, if you're sitting in a wheelchair or laying because you don't have the strength to get up and you really want to do it, and all other malingering psychiatric-based disorders have been ruled out, and everyone says, you have the ability to do it, just get up and do it, yet the person can't. And then all the great tools are added with cognitive behavioral therapy, and all of it's being appropriately applied. And if it's not working, then we have to apply the neurological piece. So one of the issues with FND is, in the literature, it'll state we have to have our best care come from our therapist, our psychologists and psychiatrists and cognitive behavioral therapists or counselors to work our way through it. And that's 100%. But nothing's really said about individuals like functional neurologists, or which I don't expect that. But it's also not talked about like physical therapists. Like, this person's not walking, let's go and maybe try to get them to walk. OT is not really talked about, or just brain rehab in general's not really talked about. So it's funny because it says it's the quote marriage of neurology and psychology, but they don't ever talk about the neurology. So of course I'm going to talk about it. But when you go, if you're really, really interested in learning about it, or you need to find out more information because you are a someone who might be dealing with this because no one's figured out, like, why can't you walk? Why aren't you able to talk appropriately? Why did you lose this motor function? Why do you have tremors all the time? Why do you have these oddball symptoms that don't make sense to anyone? It could be this. It could be this functional neurological disorder. When you go and you look at these websites, it's not that the information isn't complete, but just kind of a heads up that you're going to need neurological care and you're going to need psychological care. And that's where you want to be looking at the International Association of Functional Neurosciences, or IAFNR.org, because it would be behooved of me to not let you know. The counterpart in our profession is you can look up the American Board of Chiropractic Neurology in America. And then I know in Europe and even Australia, they have similar boards of functional neurologists. If you look up chiropractic neurologist or functional neurologist where you live, you're going to find someone, hopefully. But what I want to end on, and I hope a lot of this makes sense, I think I hit all the highlights and lowlights for that matter, is just some resources. And I can have producer Nick get them in the show notes. But one of them is fndsociety.org. That's a great website with information. Neurosymptoms.org. That was started by a PhD neuroscientist with plethora of information. Brilliant man. It's ironic. His name left my head. I'm sorry. fndhope.org, fndaction.org, and ninds.nih.gov, or National Institute of Neurological Disorders and Stroke.gov. They have information on FND. And then rarediseases.org /rare-diseases/FND has it, or rarediseases.org has information on what this FND is. But the takeaways are sudden motor loss, sudden sensory input processing inabilities, sudden emotional problems, a combination thereof. There could already be some health issues that have popped up. There can be trauma of sorts, physical, emotional, social-based, spiritual trauma that has engaged this process of the brain just kind of falling apart. And then on top of that, there's probably long time standing health issues that are a lot of the same. Being overweight, having chronic emotional distress, whatever it might be. And then you have your big triggering event. And a big triggering event for a lot of people, especially these young females, is COVID. And FND affects girls more than boys because women brains are meant to be more social. And part of this process is being able to sort out thoughts, emotions, motor functions, and sensory input. And your social functions involve all of that. And a woman's brain absolutely revolves around that. And that's unfortunately why women are hit a little bit more than men. Then to top all that off, like a lot of things that are creeping up in the neurological space that are getting worse is that the resources may not be there. So you really have to advocate for yourself or your loved one to make sure you're getting a functional neurologist on hand if possible. Make sure you're getting physical therapy, occupational therapy. Make sure you're getting any sort of other base therapy like that. Do you need feeding therapy? Does your kid now need behavioral therapy because of it? And then, of course, cognitive behavioral therapy and any sort of psychological or psychiatric help. Medications, if that's what you feel has to be done. The show isn't about spewing my opinions. I'm sure you guys have picked up on what some of that is, but that's not what this is about. This is about getting the information out as unbiased as I can, in a way, to just make sure people understand it. But like a lot of neurological disorders, the resources, again, are just not there, especially in the States. It's a bit of a soapbox of mine, but there's a couple things that are not well understood, not well understood, but not well taken care of in traditional medical space. It is chronic neurological disorders and autoimmune disorders. There is no autoimmunologist. And then when it comes to fixing brains, that's not what traditional neurologists do. They don't rehab brains for a living. They figure out if there's pathology, they have drugs, they have surgery, they refer to other specialists, and that's kind of where it stops. But we're finding out, and we found out now what seems like 20 years ago, we can really rehab and fix these things without that stuff. And that's just because if we can fix the problem, why not fix it as opposed to mask it or chop things up or take a drug to further let the process continue. It's just, that's another conversation. So that is FND in a nutshell. I hope that it all made sense. I had trouble piecing together how I wanted to make this presentation, but hopefully it's helpful. And then I'll have to make sure we get some of these resources into the show notes. And I'll talk to you guys next time. All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. Shed Light Cold Lasers is, bar none, the biggest thing that has changed our practice at HML. Not only on a professional basis and the results that we are getting with our patients, because for all the professionals out there, everything from veterinarians to medical doctors to everyone in between, you can use this laser in your practice for just about anything. But on a personal basis, because what's unique about this laser is it is handheld. And if you know anything about cold lasers, a lot of times they're big, they're gaudy. You almost have to bolt them to a wall and you can't take them anywhere. This one you can take anywhere. That's because the diodes are LED, so it runs on really good lithium-ion batteries. And the other awesome feature about this, if you know anything about lasers, is that you can kind of see it on camera there. This laser has red light and infrared light. So we won't go into the details there, but just know that you got all of those features. It also comes preloaded with all of the presets to work on specific organ systems, to work on different areas of the brain, like our specialty at HML, as well as a whole host of other things that you can do with this laser. And to learn more about the lasers, head on over to shedlightcoldlasers.com, 518-338
888-888-6658. Or you can email Dr. Griswold, or Griswold as I call him, shedlightinformation@gmail.com. And we want to note that you don't have to be a doc to buy these. You can be a patient, someone off the street. And Shedlight specializes in educating professionals, doctors, therapists, as well as lay public people, if you will. If they want to buy a laser, they will completely educate you on how to use it, or they will send you to a doc on the ground, someone like us, to learn how to use it, or they'll just send you to that doctor's office and then you can let the doc take over. Either way, they'll give you all the knowledge and information and resources you need to either get that laser or where to find one in the doc's office.